So this week we listened to the Managed Care Plan podcast, and the one I chose to listen to was titled "Uplifting Rural Communities." Um, Healthcare in rural communities is something that I'm personally very passionate about, coming from a very rural and underserved community. So it's something that I like to learn a lot about and educate on my experiences with as much as I can, given I'm not a professional or an expert, but I do know the stuff that I've gone through and witnessed. So something I'm really passionate about, which is why I chose this one, because I could relate to it a little bit more emotionally as well as academically. So, in this podcast, they kind of focus not just on healthcare in rural communities, but specifically on behavioral healthcare, which is something that is very underserved in rural communities. I can attest to that very much. I had a family member who went through a behavioral health crisis. He ended up going to a hospital, to our local hospital in our rural town, to seek help, and it was like they didn't know how to treat him. They didn't know what to do for him. And it was really sad and really hard to watch, especially as his family member. And it was just very difficult for all of us. So one of the reasons why this is such an issue in rural communities is because there's not a lot of behavioral health resources, unfortunately. I know that our closest community mental health center is about an hour away, which can make it very difficult for people who are not able to travel that far. Especially, I also feel like there's a lack of education among just general healthcare workers on mental health and behavioral health. I feel like there's a real gap in that education, especially as a healthcare worker myself. I know that I haven't personally been given a lot of education and training on it, and I work directly with patients every shift I work. So it's just sad, in my opinion. But so like I said, the biggest problem, sorry, my notes are right here. The biggest problem with behavioral healthcare in rural communities is that there's limited access. People struggle with traveling to the nearest behavioral health center, and just reaching. So therefore, they mentioned that there needs to be more funding to just kind of help integrate these communities, these behavioral health centers into these communities. But I think another thing just that I thought of while I was listening to this podcast was the fact, something that we learned about a couple weeks ago with telehealth. I think telehealth could be something that would be very useful here. Just in the fact of like therapy appointments and talking to a licensed therapist, psychiatrist, just getting checked in on. I feel like that would be a great opportunity and use for telehealth, especially in these rural communities. People could have these appointments. People are struggling right from the comfort of their own home. In fact, I know multiple people in my community that do reach out to a online therapist, completely licensed. Everything's very professional. You just communicate over a phone call. The therapist is from Kalamazoo, which is about, I believe, 3.5 hours from us. So it's just really nice that you can have that resource so far away and be able to still have that resource from the comfort of your own home. So I feel like telehealth would be very useful here, as well as because sustainability with funding there. I feel like telehealth is fairly sustainable in terms of funding. You're not funding a whole brand new office in a town that likely might not have much traction there. You can do it online over the phone. So yeah, I already kind of touched on why this topic caught my attention and raised my concerns, just personally going through that kind of experience and watching how people who aren't technically trained behavioral health professionals don't know how to treat these patients, and we might not have people who know how to treat these patients close by. So I think it's, one, very important to have the education on behavioral health, especially for those who work in a rural community, because when you work in healthcare in a rural community, you wear a lot of hats. At the hospital in my town, I know that we do not have a respiratory department. There every single day, or at a night shift, the nurses, they're respiratory, they're nurses, they wear a lot of hats, so it's important to kind of be able to interact with every different type of patient, mentally and physically. And then the other thing, like I said, telehealth. I feel like telehealth would be super important here, super useful, and just something that could really help us navigate the field of behavioral health in specifically rural communities.